Hello, everyone, and welcome back, and thank you for joining us to our fall lecture series. My name is Gwen Devereaux. I'm a member of the Board of Directors of Gateway Centre of Excellence in Rural Health. Gateway is located in Goderich, Ontario, and to the best of our knowledge is the only community-driven rural health research centre in Canada. Our mission is to improve the health and quality of life of rural residents through research, education, and communication. Gateway launched the virtual lecture series in February of this year, and at that time, with COVID-19 restrictions continuing to tighten, there was no better time to launch this initiative. 7 months later, we are hoping to come together in person soon, but still provide this avenue of communication. Through these lectures, we want to contribute to rural health knowledge and innovation with virtually connecting our communities. I'm going to pass this over to Dr. Feng Chang, our chair of rural pharmacy here at Gateway, and she will introduce herself and pass it beyond to Joshua.
Thank you very much, Gwen. So welcome back, everyone, to our Gateway lecture series. We hope you all enjoyed your summer. As Gwen mentioned, I'm the chair of rural pharmacy, and currently I'm also a pharmacist and faculty member with the University of Waterloo School of Pharmacy. So today I have the honor of welcoming an exciting roster on our panel to discuss questions surrounding rural vaccine confidence. This event is funded by the Tri-Council's 2021 Encouraging Vaccine Confidence in Canada initiative, and administered through NSERC, the Natural Sciences and Engineering Research Council of Canada. So this initiative basically aims to mobilize knowledge to improve public understanding of vaccines and also help people make evidence-based decisions. So we're very grateful and fortunate to have this fantastic forum to use, and look forward to the discussion today. We also definitely welcome your insight, experiences, and questions from the audience. So I'm going to turn it over to Joshua Poussin. He's a student on my team who's been instrumental in coordinating this project in the past summer, and he will be moderating the discussion today. Before we start, I would also just like to make a disclaimer that the viewers' views and opinions expressed during these sessions are those of the panelists and do not necessarily reflect the official position of Gateway or their representative organizations. So now turning it over to Josh.
Thank you very much, Feng. I would like to thank and welcome our panelists for today. So the first one I'd like to introduce is Andrew Williams. So Andrew is the president and CEO of Huron Perth Healthcare Alliance, a voluntary alliance of the hospitals in Clinton, St. Mary's, Seaforth, and Stratford. Throughout his 30+ years of career in his career in healthcare leadership, he's had experience spanning from small community teaching and research hospitals and the community sector, regional systems, and even private clinics. He's also very passionate for advocacy related to patients and family-centered care, and also believes that the healthcare system should be focused in ensuring the individual needs of those who use the system are met. He's also an active member of the Canadian College of the Healthcare Leaders and the American College of Healthcare Executives, and is also a surveyor with Accreditation Canada. I've also invited Andrew because he's particularly interested in vaccine confidence amongst healthcare workers, and so I'm looking forward to hear his perspective on that. And then next on the panel, we have Kristen Watt. Kristen is an owner of Kristen's Pharmacy, which is a small, clinically focused independent community pharmacy in Saugeen Shores. In addition to high-level patient care, Kristen also consults for the Grey Spruce Vaccine Distribution Task Force. She also provides palliative care at the Chapman House Residential Hospice and consults for the regional palliative care physicians. Kristen is also a University of Waterloo School of Pharmacy preceptor for student rotations, such as myself, and is also a blogger for Canadian Healthcare Network and is very active in pharmacy and patient advocacy on Twitter under her handle of Pharmacist Mama. And last but not least, we also have Matthew Maynard. Matthew Maynard appears to be maybe running a bit late, but he will join in when he's able to make it. But Matthew is a community connector at the Local, which is a community food center in Stratford, providing support and advocacy in the Stratford area community. He's also been involved with the community outreach clinic at the local, helping ensure individuals and families are making informed decisions for their safety and wellness. Matthew is also committed to the well-being of everyone in the communities, and I've also had the pleasure of speaking with him before, which is why I invited him to share his perspective through his role. Matthew is also a patient partner to the Huron Perth Area Ontario Health Team and its members organizations. And he's also worked on a number of other community initiatives, including Canadian Blood Services, Gateway, Huron Perth Public Health, Indigenous Talking Circle, and much more. So without further ado, I'd just like to mention that prior to this event, I had the opportunity to speak with individuals working inside and outside healthcare for the Vaccine Confidence Project around the rural Southwestern Ontario region to provide some local context on rural vaccine confidence, particularly with the COVID-19 vaccines. So for this session, I have some questions for the panelists surrounding the topics that frequently came up with my conversations with the locals, just to hear the perspectives from our panelists. As well as for anyone attending this event, please drop your questions in the Q&A chat box. And then in the last 15 or 20 minutes or so, we will use that time to address any questions that you guys have, and we'll direct to the panelists. So just to kind of start things off, I'd like to ask the panelists to briefly explain your day-to-day activities and your roles, and how you've utilized your positions to contribute either to the COVID-19 vaccine rollout or to encourage vaccine uptake in your communities. And we can start things off with Andrew first.
Well, thanks very much, and thanks everybody for joining on this conversation. It's, I think, a remarkably important topic. COVID has consumed our lives for the last 18 months, and there's not a single person that hasn't been touched either personally or professionally by it. So kudos to Gateway for hosting this. As was pointed out, I'm President and CEO of the Huron Perth Healthcare Alliance. So we are one of the hospital organizations within Huron Perth. And from a vaccine perspective, a few things just to flag. We have introduced as an organization a mandatory vaccine policy for all of our team members and anybody who aligns with the organization. So from that perspective, we're very visible in the community, advocating for the importance of the vaccine. We have operated one of the assessment centers since the beginning of the pandemic, and across Huron Perth, there have been about 117,000 assessments done of individuals who needed to be tested. So we're very involved in that space, along with Goderich and Listowel Wingham. We have worked closely with Huron Perth Public Health. They are certainly the lead organization from our perspective in positioning the importance of vaccines. They have a mass vaccination advisory committee that I sit on, and other members of our Ontario Health team. We also very clearly advocate through social media. We participated in a number of videos, for example, on the importance of vaccines and vaccine confidence. And as an organization, we're quite visible regionally with other hospitals and other healthcare providers. So, our view really is that from a vaccine confidence perspective, we have a significant accountability to get information out into the public eye to make sure that people have the right information to make the choices that they need to make. But as I said, we're very much a very strong proponent of why vaccines are important.
Thanks, Andrew. Okay, if I go ahead, Josh?
Yep, go ahead.
Thanks, awesome. So thanks for having me. It's great to see all the attendees. I recognize some names because I'm originally from Goderich. So hey, Dan, hey, Marina. So I am a community pharmacist in a retail environment. I own my own pharmacy. Since the beginning of COVID, we've been providing a great deal of information to our patients and to our followers on our social media about COVID and safety, et cetera. So when the vaccines came out, we made it a priority to be available to our patients and to our community to be the go-to people on these questions if they need a point of access. Many of you know, if you pick up the phone and try to call a healthcare professional, it's very difficult to get certain people on the phone at times at that particular moment when you're available. You can make appointments, et cetera. But if you pick up the phone and you call a community pharmacy, you can get a pharmacist on the phone. And so we were a really important touch point for our community. I joined the Vaccine Distribution Task Force when it was formed early this year. But prior to, I had already been providing and posting information about the development of the vaccine to various community groups and onto our store Facebook page, which gets so many clicks. It's phenomenal that people are paying attention to us in that regard. I remember posting over the holidays about how mRNA vaccines were made and things like that, and then needing to take a break for a few days, given how much information we were putting out there. It's been coming at us really fast. And given that I have immersed myself in this nonstop now for 18 months, and it's overwhelming for me, I can only imagine how overwhelming it has been for other people. This is all I've done. I'm not in a hospital saving lives or providing care to patients. I am doing that in a community pharmacy setting, but I have a lot of staff, which is fantastic, which has allowed me to focus on this, to provide this level of information. So that's what we've been doing, from blog posts that I do, from Twitter, right down to administration of the vaccine. So I'm in Grey Bruce. I was the first and only pharmacy offering the vaccines in Bruce County, and one of only 3 in Grey and Bruce County when they were rolled out in our region. So that was in April. So 10,000 square kilometers, there were 3 pharmacies. So you can imagine what it was like for us to administer these. And in the early days, it was actually quite easy to get people on the list to get their vaccine. We didn't have a lot of vaccine hesitancy because the people who wanted it came forward first, and that was great. And then when the tide changed and we had tons of vaccine and then demand slowing down, that's when our role in addressing vaccine hesitancy really exploded. We're out there every day educating people. I'm still getting people in for first doses right now. And there's been a big shift in our conversation. At the beginning, a lot of it was, yay, I'm so excited you're here. I'm so excited to give you a dose. And now it's, you haven't come yet. There's a reason you haven't come yet. Do you want to talk about this? A lot of people are coming to us now because of mandates. I am so glad that the Huron Perth Healthcare Alliance has implemented a mandatory vaccination policy. I really hope they do that at the various facilities in Grey Bruce. So a lot of these people are coming because they have to. The OMHA has put out the vaccine mandates. I'm really hoping the Minister of Ed does that as well. So we're addressing people's hesitancies as they come in because they're feeling forced to come in. So we need to be a place of factual, non-scary information for these people when they come. And I tell everybody, facts, not fear. I'm not here to change your mind. You still have to consent for that needle to go in your arm. Nobody is ever going to hold you down and force a needle into your arm. You have to make that choice, but you have to be comfortable with that choice. And if you feel pushed into it for work or hockey or whatever, you're not going to be comfortable with it. So let's talk about what made you uncomfortable with it, and I can provide you that information. So it's been a ton of one-on-one. In Grey Bruce, we are the #1 vaccinator outside of the health unit, having done over 4,000 doses in our pharmacy. So that's a lot of conversations and a lot of hesitancy that we've addressed in the last 6 weeks or so specifically, and we'll continue to. There's a number of pharmacies who aren't offering the vaccines anymore because it's very labor intensive, especially now. But we're going to continue to do that. We've committed to carrying this community through to see the end, because I'm excited to see what's coming next.
Thank you, Kristen and Andrew, for that. It's actually particularly interesting you brought up with the vaccine mandates. So I know in the hospital setting, it seems like some of the hospitals are already enforcing it. I guess we'll see if it's going to be applied to other settings. Now, since we're focusing on the topic of vaccine hesitancy, based on your current experiences and your current roles, what were the most common concerns you've heard from either patients, community members, or your coworkers regarding the COVID-19 vaccines? And which of the concerns did you feel were justified by them, and which of them were based on misconceptions? We can start off with Andrew.
Thanks. And I want to give a shout out to Kristen. I've been following her social media since the outset of the vaccines, and you're always very visible and positive, and it's a hugely important piece of the puzzle. Now, I think when we look at our situation, and I can talk specifically about our organization and then sort of extrapolate a little bit, but we early in the summer, we asked staff, physicians to identify whether they were going to get the vaccine or not. And we asked individuals to submit what's called a declination form if they weren't going to get vaccinated. And the largest majority of people who responded to that were individuals who were either pregnant or were thinking about having families. When we look at sort of the anti-vax, anti-mask segment that tends to get a lot of airtime, I think that's a very small percentage of those who are yet to be vaccinated. So, when we look at sort of the barriers, I think what's happened, and, I get asked if we made the right decisions, 3, 4, 5 months ago. And I always say, we made the right decisions in the moment. We may make a different decision today. And I think there's been so much information that came out or has continued to come out on vaccines throughout the pandemic, that it's almost information overload. And when we look at the conversations today, and we'll take pregnancy, it's very clear with the literature and the science that the best course of action is to get vaccinated. But early on, when people were just starting to see vaccinations, it wasn't as clear. So I think one of the challenges that we have as we deal with individuals, and I agree with Kristen 100%, it's one-on-one conversations to try and create that confidence in individuals to get the vaccine. It's understanding, what are their hesitancies, what information can we provide that might help address some of those concerns, and then how do we then obviously make it accessible to them. But the biggest issue we have found is that it's been the volume of information that's out there and the perceived discrepancies in the information that's been shared. So if you're kind of on the fence and you're not really sure, and you're reading two different stories and they're both diametrically opposed on the pros and cons, it's hard to land on a decision that you're comfortable with. So for us, the majority that as I said at the beginning, tended to be in a particular age group. So we've been working hard on that. And we've been trying to focus our energies and efforts around, and we focus on vaccine confidence, not vaccine hesitancy, just to try and put a positive spin on it. But it's really been very targeted to certain age groups, primarily, who have specific concerns that they've raised.
Great. And I've seen in the early days, it was about the rate of vaccine development and how quickly these were made. And I acknowledge that could be concerning from somebody on the outside, not understanding necessarily what a vaccine development schedule normally looks like and what the delays are when they're usually about funding and not about actual research. And I actually share with them, like, full disclosure, the Moderna vaccine was developed in 2 days. And that is actually a huge, huge win for science. That's a function of no financial constraints and a great advancements in technology over the last 30 years. Vaccine science is not new, and we're informing our decision-making based on our past. So while it was developed officially very quickly, the testing stages were not rushed, and I continue to remind people of that. We've gone through all of the requirements for testing, et cetera. Another thing that I often heard was, well, it's not officially approved. That's not actually true. In Canada, they were approved by Health Canada right from the outset. We never used a vaccine that wasn't approved. In the United States, they had them approved under an emergency use order through the FDA. But in Canada, they were fully approved right from day one. And that's really helpful for people to understand. And I explained to them was because we were able to submit data on a rolling basis over to Health Canada, which is new. We don't usually do that. Here's all your files, you review and let us know. What we did with the vaccines here is we did it on a rolling basis. Providing all these little pieces of information that aren't getting out to people necessarily through big media splashes is what I have found to be the most effective way to get through to people when they see what's happening. I also remind people that differing opinions don't necessarily carry equal weight. And that's really hard. We are very good at listening to both sides and trying to make an informed decision, but both sides don't necessarily carry equal weight. And I give them an example of this. If somebody says the earth is round, somebody else says the earth is flat, the earth is not egg-shaped. You don't give equal weight to both arguments. And on picking the experts and following the people who have followed this right through, who are working in these environments, that's really what's going to give you your best evidence. You don't have to listen and give equal weight to those countering arguments, because that's where the confusion and the fear is really going to come in. And I think we're going to see a lot of this when we get the approvals for children. I've already been doing a lot of communication about the approvals that are coming for children 5 to 12 and how we need to wrap our heads around being open to accepting the vaccine when it's time for our kids, because we know, as experts, we know what's coming, and we need to convey that vaccine confidence. And I love that. I'm going to stop using vaccine hesitancy, vaccine confidence. We need to convey that to the parents that are out there, because I'm a mom and I understand why parents can be very worried about what they're about to do with their kids. So, it's my body, I'm going to do it, I need it, but I'm not sure if I'm going to vaccinate my kids. We really need to address that confidence level prior to the approvals. People need to be ready to accept when the time comes.
And
Thank
maybe
you
just
for-
add one other quick point to
Go ahead.
that, with the confidence piece and what were the most common concerns. I think when AstraZeneca was rolled out and it was then pulled back, that created, I think it enabled those who were looking for reasons not to get vaccinated to hang their hat on something and say, okay, well, obviously there's issues. And we have an accountability as healthcare professionals, and I agree with Kristen 100% that we need to have those one-on-one conversations. We need to make sure that we are driven by science and giving the weight to those pieces of the discussion that truly do warrant it, because we're seeing a lot of rhetoric out there, unfortunately, and it's hard to counter that at times. But we have to be very consistent in our messaging, as individuals who are advocating for further uptake of vaccines.
Absolutely. And I remind people that the vaccine rollout was political, but vaccine science is not. The vaccine rollout was very challenging on the front lines. We heard the news when other people heard the news. That was extremely challenging. When the AstraZeneca controversy began, I joined a group. We now call ourselves Focused Communication, because we weren't happy with the way that the communication was coming out from various governmental organizations, because their hands are tied and there's so much bureaucracy. So there was a number of us that got together and started creating infographics. And they're housed on the University of Waterloo Pharmacy website. And the first one we did was on AstraZeneca and its safety, because at the time, especially in the middle of that third wave, we were so confident that it still provided the best outcomes that we decided as a group to start sharing this information and our confidence in things, and have had great response from people. So again, finding those resources that you trust are really going to make or break and be the difference for people.
I really like the way we word vaccine confidence. So, straying away from hesitancy and confidence, which is actually going to relate to another question I'll be asking you guys later. But most importantly, I guess one of the factors that impact vaccine confidence is the ever-changing changes in information that's being put out to the public. COVID-19, for the most part, it has just, been recent in the past couple of years, and then we just had vaccines. And so for the public, it can be understandable how overwhelming we get all these rapid changes. So taking that into account, with the rapid changes in messaging, information that appears to, contradict previous information, one of the interesting things I've noticed when I was talking to some healthcare providers in the area is the idea of practicing good science in medicine, which typically follows what we call the scientific method. So part of how that works is, it's the process of how we, discover information, how the information is interpreted, analyzed, and critically appraised. And, depending on how that goes, that to include being open to accepting new evidence and applying it, even if it contradicts what was previously done. So, before we were advocating for, giving the AstraZeneca COVID-19 vaccines, and then now we have more of a focus on Moderna and Pfizer. So, in your respective roles, how would each of you try to explain the scientific method to someone who is not necessarily familiar with the process?
Kristen, you can start with that one.
Sure. I tell people science is dirty, it's really messy, and it doesn't care about your feelings. Science happens, and it's been happening really fast. This is a good eye-opener for a number of people at how much data and information that we scientists and healthcare professionals are dealing with all the time. But this time it happened in the news. And the news is also extremely sensational. I've been on CBC, Global, CTV a number of times, and the questions and the setup that always gets asked is slanted towards the negative, because that's what sells. So I always try to bring it back to the positive and the celebratory things and the things that are happening to look at. I tell people that my mind is never made up, ever, because with more information and more evidence, my opinions will change. My opinions will always be changed by people who are smarter than me, especially. So I surround myself with people who are exceptionally smart. I follow those people on Twitter. I use the resources that they use, because I need people to understand that it's rare that people consensus is changed by people who are Google searching or reading memes or watching YouTube videos. But those are the things that are sensationalized and that are out there that are going to make the most noise. So I tell people it's messy, it's going to change. I'm not at all surprised that things have changed throughout this. This is exactly how science works. It's also evidence that science does work. And that's really important. If we were doing the exact same thing today that we were doing a year ago when it came to vaccines, we would have missed so much. It shows that the scientific process does work because we're following it and we're adapting to change, and we need to continue to adapt to change.
Yeah, the one thing that I would add, and there's a comment in the chat box about people don't believe what they're seeing and they don't believe the numbers. And so, one of the things that we try and do is just be very factual with the stuff we do have. And now for your listeners today, we've had in our hospitals within Huron Perth Healthcare Alliance at our Stratford site 114 COVID patients, 34 of whom have sadly passed. Since the vaccines came into effect and were accessible, less than 5% of the hospital admissions that we've seen are fully vaccinated individuals. So, one of the things that we're really trying hard as a health system to flag is that the people who are getting sick and the ones who are the sickest are, for the most part, not vaccinated. Where you do get a vaccinated individual who gets sick, it's because they're immunocompromised otherwise, which is why we're hearing conversations around a third dose for targeted populations. But the numbers are compelling. 95% of our hospital COVID admissions in our reality, not fully vaccinated. And if that information does not sway, it's hard to hang your hat on other things, right? I mean, we're seeing right across the province, right across the country, and I'm not sure I like using this, but it is a pandemic. It's becoming more a pandemic of the unvaccinated, whether we like to admit that or not. And when we look at our ICUs and our hospital beds, more and more of the people who are in those from a COVID point of view are unvaccinated. So that's what I like to focus on is what are the real numbers? Like what are the compelling numbers that can maybe bring this, make it more real, right? When I read a research paper, it's not necessarily real, but when I see the local hospital coming out and saying, here are the numbers, and here are people from your community that are in our four walls right now being treated, that's how we get the information out there.
And Kristen, did you have anything else to add to that?
No, I think I'll leave it for now. I keep going on and on. When it's my turn anyways, I'm sure I'll have something else to add after that.
Sounds good. All right, so I'm going to actually take a step back. I'm going back to the whole, starting to use vaccine confidence as the term we should use and not vaccine hesitancy. And I actually think this is very important. So I'm going to give kind of an anecdotal scenario that I've encountered with one of the locals I was speaking to. So imagine an individual that was, vaccine hesitant, and because they weren't familiar about the information related to the vaccine, they were hesitant about getting their dose, but then their peers or friends, families around them have gotten vaccinated. And because of the, I guess, of the feeling being judged, of being hesitant or being afraid to seek the information, there's scenarios where some people have, lied or even, or lied about, their vaccine status. And it's kind of, maybe realize that there's a whole stigma associated with vaccine hesitancy. And if anything, maybe the word vaccine hesitancy might be creating that sort of stigma. So, taking this into account, how can we ensure that the messaging that we provide to the public about getting vaccinated takes the stigma into account while also ensuring that there's still a sense of urgency when we deliver this message?
I think it's really important to come at all of our communications with empathy, but with urgency. So that's what I've really been trying to do, especially lately in a lot of my posting, is it's urgent. We need to get vaccinated. I understand you might be hesitant, so here's what I think. And I've done that actually surrounding pregnancy, fertility, and kids lately. So for example, in pregnancy, the things that I've said is that we know that that the COVID-19 vaccine is safe in pregnancy. And at this point, we are not just comparing the vaccine versus no vaccine. We're comparing the vaccine against the virus. There's good evidence out right now that in the next 6 to 12 months, 80 to 90% of unvaccinated Ontarians will contract COVID. COVID-19. And that includes our kids and our pregnant women, et cetera. So I tell people, now you're looking at the vaccine versus the virus, and what do we know about each of those and their safety? And so we talk about the risks of contracting COVID-19 in pregnancy versus getting the vaccine in pregnancy, and that seems to resonate. It's calm, it's rational, but it is urgent. I'd really rather you get the vaccine while you're pregnant, in fact, than waiting until you've had the baby and are nursing, because I can't promise you won't get the virus in that time. When talking about it with younger children and the concern about heart inflammation, we're talking again about vaccine or virus. We're not talking about vaccine or no vaccine. And the reality is that COVID-19 causes heart inflammation or myocarditis and pericarditis at a much greater rate than the vaccine does. So we have to understand what actual risks we're looking at. So when I talk to people about their vaccine confidence, that's the kind of information that I'm giving. I'm talking about this or this, but we have to understand it's no longer vaccine or no vaccine. It's truly going to be vaccine or virus. And people like to use the term natural immunity. I'd rather wait and have some natural immunity. We in the medical community are switching our wording on that. It's not going to be natural immunity. It's going to be disease-derived immunity. You develop that immunity because you had the illness. And a few things on that. And one, it assumes that you survive the illness. And that's what I say to people. And then they're suddenly like, oh yeah, well, there's that reality that I can't control what may or may not happen once I have the virus. Two, we also know that that disease-derived immunity is not nearly as strong as the vaccine-induced immunity. So we really want people to get that vaccine. And three, they're looking at those rates of heart inflammation and potential heart complications now with a different lens. It's not vaccine or no vaccine. It's not myocarditis or no myocarditis. It's the potential for having a complication versus a greater potential for having a complication. And that's seeming to shift things a little bit for people when you just lay it out like that, and they kind of can see those numbers and see what's happening and what's coming at them.
I'm not sure what I can add to that, Joshua, other than I'll say that, one of the things that we see, it's not the individual surrounded by people who are vaccinated. It tends to be the opposite. It tends to be, our staff, for example, who live in families or have extended families who don't support the vaccine, and them they're put in a very difficult situation around their decision. And I think it goes back to what we started with. We just have an obligation to get the information out and to make sure people have ready access to the questions that they have. There's a number in the chat box right now. I draw the analogy of seatbelts. Seatbelts don't save every life, but they very much save a lot more than not wearing them. And I look at vaccines the same way. They're not perfect. They're not the golden the gold at the end of a rainbow, so to speak, in every case, but they certainly do strengthen our ability as individuals not to either get it or get it seriously. So it's getting that information out and having one-on-one conversations, and I really believe we're at that point now. It's the one-on-one dialogues with people who you trust. Whether it's your pharmacist, whether it's your primary care provider, whether it's family members, but sitting down and having very serious conversations with those who have your best interests at heart and are going to have the information available to answer questions you might have.
Thank you for that. So I'm going to go with one more question for now, and then I'm going to check the Q&A chat box to see if there's any other questions. I see a few, so we will go to those afterwards. So now I remember, Andrew, in the beginning you were talking, you brought up again about the mandating of the vaccine to hospitals. So I guess specific to you, and then I have a similar question for Kristen afterwards. So for Andrew, what do you think was the impact that you've got so far from the mandating of vaccine in the hospitals, and did you receive any backlash? And then for Kristen, I'm curious to know if you've had any concerns or potential conflicts with any coworkers who've had the same certain opinions about mandating vaccines in the workplace, and how you are going to try to be proactive about in the future if you have any try to recruit any future members into your team. But I'm going to start off with Andrew first about the hospitals.
Yeah, thanks. We've designed our policy to have a fairly lengthy runway to give those who at this point have decided not to get vaccinated the opportunity to get information that might help with that decision. We're at about 94% of our team with at least one dose. So we have really good uptake as it stands. The feedback that we've had has been largely positive. But I'm not naive to think that those who are opposed to it are going to come out and say publicly that they disagree with it. So you tend to skew to the positive feedback. I've had a couple of staff who very clearly don't support what we're doing. And ultimately, they're going to have to make a decision on what's important to them. And I will fully respect the decisions they make. I don't want to see anybody have to leave the employment of the organization or give up their privileges. But there are certain times where you have to draw a line in the sand. And I think given the impact that this pandemic has had and continues to have on everybody's life, organizations that deal with people who are vulnerable have an accountability to step forward. And, we're really trying to promote that. And I do think when it's all said and done, we may have a very small percentage who continue to hold views that won't allow them to get vaccinated. But between now and when that time comes, we're going to do everything in our power to get the information in front of people that will help them understand sort of why we're taking the position that we are, and give them the information that they can utilize, hopefully, to make a decision that they're ultimately comfortable with. But it really is going to boil down to individual choice for some when it's all said and done. And our organization, our first priority legally is safety, safety of staff and safety of patients. And no matter how you cut it, the more who are vaccinated, the safer the environment. And so, we're sort of taking that perspective in all of our conversations.
And so we were, my entire staff is vaccinated. I had 20 people on staff in July and helping us with the vaccine rollout, et cetera, and everybody was vaccinated. We were so excited to get vaccinated that we didn't even consider confidence or hesitancy in the pharmacy at the time. It's now a requirement of hire that I can make in my private small business, and I will continue to enforce it. And on the vaccine distribution task force, we have advised a number of other employers about their rights and their responsibilities to keep their employees safe. And we did have one local large employer that was having some challenges. He had 5 vaccine exemption forms on hand with a staff that did not lend itself to having that many people exempt. The focus communication group that I'm on is actually putting out a piece very soon. We're in the editing stages of what constitutes a legitimate vaccine exemption. And I'll tell you that there aren't very many. In fact, there's only 2. And they are confirmed allergy after the first dose that has been assessed by an allergist. And that also includes an allergy to any of the ingredients before a first dose that's been assessed by an allergist. And the other is having myocarditis or pericarditis after the first dose. And those are the only 2 hard and fast reasons not to get vaccinated. So we went back to this employer as a group and said, look, I think that there's an opportunity for you to go back to the employees and have further conversations. And they did actually request some additional medical evaluations, et cetera. And they were able to reduce the number of people that were unvaccinated in their location down to 1, because we should be seeing very, very few true exemptions from the vaccines. And I support that wholeheartedly. I do think, as Andrew does, that if people are working in these environments providing care, we need to provide the best evidence-based care to our patients. And that includes exposing them to vaccinated individuals over them providing that care at that time. If I'm going to follow the evidence about any other of the care that I'm giving, I need to follow the evidence about the vaccines. And it's truly a huge body of evidence at this point in time. It will be the most studied vaccination campaign in the history of humanity when it's over.
Yeah, we've been very clear on the exemption piece internally, and it's very tightly defined around allergic reactions, specific ones, or first dose reaction pending clearance from healthcare providers. And all the physicians in Huron, Perth have actually come out with a joint statement with public health that clearly says, here are the only reasons we will provide an exemption from a vaccine vaccine. And it's important just for consistency of messaging and making sure that the information is clear, concise, understandable. And if people have questions, they know who to talk to.
All right, thank you, Andrew and Kristen, for sharing your insights. So I'm going to look through the chat box for some of the questions from the audience members. So there was a question from Donna about individuals not believing numbers in cases, which I think Andrew touched upon at the beginning of the panel talk. Jean was asking, is there any agencies or organizations that are monitoring people who have side effects from the vaccines that you guys can maybe share some awareness to the audience?
Definitely. Canada has a vaccine adverse event reporting system. It's not the same as the one in the United States, the VAERS, where you can report anything, anytime. If your dog died or you got struck by lightning after your vaccine, you can report it in the States. Here, it's very clear. It goes through your family physician. And if you don't have one, you can go like a walk-in clinic, et cetera, and they will complete the forms and it will be filed, and there will be a follow-up to see if we can establish a causal link, because a temporal link doesn't always mean a causal link. And what I mean by that is just because you got the vaccine and X happened doesn't mean that it was a vaccine that caused X to happen, because X happened after the vaccine. So it's really important that we establish that link before we attribute that side effect to the vaccine. So safety signals like the myocarditis that we've seen in mRNA vaccines, or the clots that we saw in AstraZeneca, we were able to establish that causal link, so it's known, and as other things get reported. The other piece of that is that these are not live vaccines. There's not a mechanism for them to cause adverse effects years and decades later. And we know that based on how they work and how they're degraded in the body, et cetera. So, but it is something that we'll continue to watch over the course of humanity, essentially at this time when we vaccinate 8 billion people in a short period of time. It's something that we're definitely watching, but in Canada, there is that reporting mechanism, and it's taken very seriously here.
I think, Kristen raises a really important point, and that is, things change, and as more information becomes available, our knowledge base expands. And a really good example is with our organization. Our board was the first, I think, hospital in Canada to come out and draw a line in the sand and say, you know what, we support mandatory vaccines. Our initial administrative response was to put a process in place that said, we will implement mandatory vaccines if we don't reach 95% of our team. And this was back at the beginning of August. When we looked at the Delta variant, when we looked at the science table projections that were coming out later in the summer, when we looked at, to be very candid, the very aggressive negative anti-vax campaign, we changed our position and said, nope, it's not 95%, now it's 100%. So, you have to be able to adapt and adjust your perspectives, I think, based on available information. And it's constantly changing, obviously. And we have an accountability to make sure that we stay on top of that.
One thing I want to add is, in my experience, true vaccine exempt people want everybody to be vaccinated because they are protected by that vaccination around them. Given that number, 80 to 90% of unvaccinated people being infected in the next 6 to 12 months, people are truly vaccine exempt, need everybody around them to keep them safe. And that's one way to assess a person's feelings about it. And it's not just based on feelings that they feel that they're vaccine exempt. People who are vaccine hesitant are kind of ambivalent about people around them being vaccinated, and truly anti-vax people want nobody to be vaccinated. And there is a distinction in those three groups.
Thank you. Kristen, that's actually a very interesting point, the idea that for those who are truly vaccine exempted, they want others to get vaccinated. So that was actually something that I didn't even think about on my end, because that basically tells us that these people generally want everyone to get vaccinated. They wish they could get the vaccine, but they truly can't because they're exempted. So that's actually a very interesting point that you brought up. So another question, let's see, one from Tracy. Have there been any types of healthcare related protests in your respective regions? Because it appears to be a challenge here in Toronto.
There were, and I can't comment on this yesterday, because that was the day where there were supposed to be follow-up. But initially there were some in London, and we had a few people at one of our sites who were, they weren't negative, but they were advocating obviously their position. So we are seeing it, and I think there's been a really great, at least social media response to it. I don't think anybody ever questions our individual rights to raise our concerns. I mean, that's one of the hallmarks of a democracy. But to do an anti-mask, anti-vax in front of individuals who are trying to save people's lives who have COVID, I think there's a very clear sentiment that that's totally irresponsible and unjustified. And I think, we're seeing the impact of that as numbers will dwindle and people will be held accountable for their behaviors. But yes, we are, but not to the degree, I think, maybe of University Row in downtown Toronto.
And I pointed out yesterday on Twitter that on your way home from the protest, if you get in a car accident, you'll be taken back to that same hospital and we'll treat you regardless of what you did prior to, because that's what true healthcare heroes are actually doing during this pandemic.
All right, thank you very much. So another question from Heidi. So one thing, I guess, for you guys is that, there's certain populations, for instance, we have like the old colony population, Anabaptist community, and there's other various populations within the region. So how do we, I guess, address vaccine confidence towards these specific populations, if you're able to comment on it?
Sure. So outreach, as a member of the Vaccine Distribution Task Force, we targeted specific communities for specific outreach. We need to understand the nuances of the culture. In Grey Bruce, we have a large Indigenous population. So going direct to the top and having those conversations with the cultural leaders, the traditional healers, people who have the most impact in their community, because me walking in saying, you need this vaccine, especially in Indigenous populations, we put them first on the list because medically it made sense. But I said to them, I have this brand new vaccine that I want to give you, and I understand your history of being tested on, but take it and just trust me. That's not going to fly. We really need to meet each individual and have those conversations with them. But in addition to that, we need to go into their cultural leaders, their trusted advisors, the people who are going to help people make these decisions with confidence. So we've done that in the Low German community around here. We've also done that with the Indigenous population, and we continue to do that and reach out on an individual basis, but also on a population basis with their leaders.
Yeah, I mean, I agree 100% that we need to engage with the leaders, and we also need to use those organizations or groups that have existing relationships. So certainly with our Mennonite populations, Anabaptist, public health has a really strong relationship. Midwives, we have a number of midwives who work with our organization, have been remarkably positive around the vaccine and have been vaccinated for the most part. And they then can get that information out to their clients in these communities around why it's important and answer questions that they may have. But yeah, you have to really identify who are the individuals who carry the opinions and get them to talk and get them the information they need to help grow the confidence in that particular population.
Thank you for that. So another question from Jane, it's so regarding labor regulations, is it possible to be fired as an employee if you don't get vaccinated?
Andrew, that's all you.
Well, and this gets a lot of airtime, obviously, right now. And I mean, the position that we've taken in our policy, and it's available to anybody who wants to look at it. The organization does have the right to establish policies, and we have taken the position, because of safety reasons, that a mandatory vaccine policy is a responsible position for us to take. So when it's all said and done, our position in the policy is if you decide and consciously decide not to adhere to a policy, you are in essence foregoing your right to work in this organization. We're not, I mean, it's going to be semantics, I suppose, but we're not firing you. You've just decided you don't want to work here because you're not going to comply with the policy. It's like me blaming the police for losing my license because I speed. I suppose I could do that, but it's me who's speeding. So, there's going to be some test cases, I have no doubts. But our position as an organization is you are making a conscious decision not to adhere to a reasonable policy, and therefore you're foregoing your employment right or your right to hold privileges within our organization. And I do expect there'll be lots of illegal machinations moving forward. But we've, the position that we've taken, and depending on who you talk to, safety trumps everything when it comes to organizations like ours. And we have not included human rights exemptions, for example, in our policy. And the information we have is very clear. This is not a human rights issue. This is a safety first issue, and we'll have to deal with any repercussions as a result of that if they happen.
Joshua, I don't want to interrupt here, but I am, of course.
Yes.
Just to tell you, Matthew was unable, I was in communication with him to connect. Wherever he was, there was no internet. And I do want to hear from Feng about this project. And honestly, you could not have had two better people of Kristen and Andrew carrying this, because you're both so knowledgeable. And Andrew, we were all cheering out there when you made it a mandate that all staff, believe me, I come out of retirement as a nurse to help vaccinate in the mass clinics. And I am pretty proud of here in Perth and how we've come forward with vaccination. I know Kristen and Gray Bruce, they're ahead of us in here in Perth in numbers. So, our people in our rural have been remarkable. But Feng, you've been very quiet and you're not even there. And I would love if you could explain to everyone this project that Joshua is working on. I think that's really important for us to hear.
Sure. Thanks for that, Gwen. I can definitely do a quick overview. So this is a federal level initiative that came out of the Tri-Council. So that's the Social Science Council, the Science Council, and the Medical Science Council, right? So the natural sciences and the medical sciences. And they have jointly pulled together this funding to fund initiatives across the country that look at basically community-based initiatives that promote vaccine confidence. So what we're hoping to do is actually do a number of things, one of which is a series of these conversations. Because from my perspective, I'm really interested in hearing what you're all hearing on the community level, right? What kind of, because every community is different, and so we're just sort of the facilitators in this to try to get the conversation going, perhaps get more people talking about it and disseminating some evidence-based information. Just looking at the chats and the Q&A, there's already lots of great questions, which will help inform our next steps. So I realize we just have a few minutes, so I'm actually at the end, when Josh is done, Daniel can come on and say a few words and introduce himself, because he will be coordinating this project in the next term or so, and he can also just give us an idea of what he has in mind as well.
Okay, so Daniel, if you wanted to unmute your mic. So
sorry there, my internet cut out for a second, but I'm back. My name's Dan. I am also working on this project to look into vaccine confidence in these rural counties, and we are starting a program basically to connect volunteers who are vaccinated and want to hear more about want to improve vaccine confidence in the region with those who have hesitancy or are unvaccinated for either barriers or just general confusion. I mean, as both the panelists discussed, there's been a lot of information out there over the past 18 months, and it completely makes sense why some people still feel that aversion to being vaccinated. But the hope is that hearing from people in their own community, hearing people that are educated on what the facts are and can kind of guide them through data and help them make that medical decision basically for themselves by showing them the reality of vaccination and what it's really like. By sharing their experiences, then they can improve that vaccine confidence in the region. So I'm going to send a link if anyone's interested in that at all. We're doing a session on September 29th, a training session on how to provide that peer support. And even if you can't fully commit to that, if you'd like to come by and hear about information about the vaccines and how to support people that you might know that are unvaccinated or vaccine hesitant, that would be great. And I will send the link right now. And that's all I have. Thanks.
Thank you, Daniel. Thank you again very much, everyone, for attending this event. You've all provided some excellent questions, as well as thank you very much, Kristen and Andrew, for providing your insight on the topic. Unfortunately, because of the time, we weren't able to address all the questions, but we have seen all your questions and we'll keep in mind moving forward with our vaccine confidence project. As well as, I don't know, Gwen, if you have any last words.
I do. I always have the last word, Joshua. If you knew me more, you would realize that. So I want to thank Dr. Chang and the panelists. You were awesome as usual, Kristen and Andrew, and Feng for creating this conversation. It's a really an important one, because I think at Gateway, our work is to examining all rural health issues and supporting our rural residents. And today, I think you've helped us understand more clearly the complicated topic, and perhaps have increased our knowledge, and we then can support, because we all have friends and family who are hesitant to be vaccinated, and we're struggling with it. There's anger out there and frustration, and I hear that anything we can do to support that and support these families that are dealing with this. A huge thank you to our sponsors, Bruce Power, Larry Otten Construction, Ian Murray of CIBC Wealth Management, DeJager, Town Square IDA Pharmacy, and the town of Goderich. Without your support, the lecture series would not be possible. Gateway Center of Excellence is a not-for-profit organization with charitable status, and we greatly appreciate and welcome the support we receive. Lastly, thank you again to all the attendees for joining us today. We will see you back on Tuesday, October the 5th for our next lecture. We hope you will pass this information along to your networks and expand the reach of this lecture series. Our aim is to promote the knowledge economy while improving the health and quality of life of our rural residents. Thank you so much, and Gateway wishes you a safe and healthy autumn. Take care.